Can you introduce yourself the way you'd like to be known?
Sure. My name is Mark Bertin. I'm a developmental pediatrician from the New York area. I do a lot of work with ADHD, a lot of speaking around ADHD, but also one of my passions is the integration of mindfulness into general pediatrics, pediatric care, supporting families. So I'm out there trying to do all of that. So yeah, glad to be here.
What's the difference between a normal pediatrician and a developmental pediatrician?
I get asked that a lot. There aren't enough of us out there, but developmental pediatrics is like a subspecialty of general pediatrics, just like cardiology is, where you do general pediatrics and then study the heart. So in my field, you do general pediatrics and then study child development. It's almost like being a psychologist most of my day. There's actually two subspecialties that are closely related, neurodevelopmental and behavioral development. So I do behavioral development, which means supporting children a lot with ADHD, autism, learning disabilities, things like that.
So the way a family might reach you is their pediatrician would refer them to you if the child
Um,
has a neurodevelopmental disorder.
Although the reality is at this point, most people come to me directly. Parents come directly, schools send kids to me, pediatricians send kids to me. It's a mix of all of that typically. And I love it. My day is paced really more like a psychologist than a physician, spend a lot of time per visit. I try to do a lot of close follow-up, helping parents manage, dealing with schools, making all the behavioral decisions they need to make outside of school, talking through the medication stuff if they want. And then for anyone who's interested, try to mix in mindfulness-based practices. I don't force it on anyone, but for anyone who's interested.
That's great. So you can prescribe medication. You do some talk therapy as well.
I'm not actually a licensed therapist. I do a lot of parent work, helping parents manage behaviors. I don't, when it comes to ADHD in particular, since kids with ADHD are delayed in the skills to let them manage their own ADHD, it takes them longer to take the lead on their care. I'm there doing a lot of work with parents and how to make that go more smoothly.
During your years in practice, and you've
Uh-huh.
been at least a couple decades in this,
Uh-huh. I have.
have you seen many more girls as patients than when you started?
I would say yes, but not necessarily in a slow, gradual way. What happened was pandemic related. When everyone had to go to homeschooling, it just revealed a lot, particularly about these inattentive, disorganized symptoms that go along with ADHD. I just saw someone for the first time and they didn't have any idea the severity of what was going on until they had to directly supervise home learning. I realized there was none going on at all because it was undiagnosed, inattentive type ADHD, but practically speaking, that's what it is. Yeah.
So, are you saying that you saw a surge of more girls coming into your practice after?
I think it became more balanced. I think you would say, from looking at the statistics, kids who are misbehaving tend to get diagnosed younger. Once parents really got to observe the inattentive type of ADHD, which is more predominant in girls, reality hit them differently and understandably because it was right there. For kids who are relatively strong academically and behaving well, their symptoms get written off a lot. Their symptoms are just a little
Bill?
flighty or, yeah, it's okay, they're getting by. ADHD can hit anywhere in life, but if the predominant issues are in managing school, then parents don't really see most of those hours. They might not be observing it directly. For kids who are disappearing into the back of a classroom, the school may not be raising any red flags at all. A friend of mine said that with ADHD, it can be like a duck floating on the water. It just looks like they're totally calm on the surface, but their legs are going a million miles an hour underneath the water. Those students don't necessarily get picked up in a traditional school setting. They might be okay, they're a little bit stressed and they're getting B's and cool, good enough for us. And without any real sense of the volume of inattentiveness and forgetfulness and difficulty with time that's going on that would otherwise just have been missed. I wish I could say it has to do with a more general awareness of the inattentive type of ADHD. There probably is more in that. There have been some wonderful, strong advocates pushing awareness for a long time. But I do think a lot of it is very specifically related to the home learning experience.
Do you have a sense of what teachers could be doing better to, or what society could be doing better to support
Um,
teachers to catch girls?
honestly, I think the starting point is just a big educational gap. My understanding of teacher training, as well as anyone who's talked to me about it, is that there isn't a lot of emphasis on executive function in the classroom, executive function as a path of development, which is really what ADHD is, practically speaking. The best way to understand ADHD, I think, as an adult trying to support a child with ADHD is to depersonalize it. It's a skill set that's behind, and it's a very broad one related to executive function, not just focus. I think the starting point, there's kind of two huge pieces that we can explore. One has to do with the general education. It is not my sense that most people hit the classroom with a really solid sense of what executive function looks like and what delays in executive function look like. And the fact that it's very demand related and it doesn't mean you're a bad kid. It could just mean like you're the most wonderful kid ever and you just can't see or manage time. And that's still a problem to work on, even if your grades are reasonable. So
It's
some
so
of it has to do with,
surprising. Yeah, because it's so surprising. I've been hearing about executive function for more than 15 years now. And
yeah.
the fact that it's not a primary thing that's taught to teachers.
It's my understanding that it's not unless
Yeah,
you get like a master's in special education, but I
yeah,
could be
yeah, yeah, yeah.
wrong that some schools are doing it, but that's my
Right.
understanding. And then the second piece is way more nuanced. It might be worth going into quickly the model of executive function that I think is most practical because that ties to how to support kids who struggle with issues. The model of executive function that I find most useful in day-to-day life is actually Thomas Brown's six-part model. I've changed the language about it a little bit when I write about it, but it's the same model, which is six parts of brain management, things you have to manage and coordinate. So it's attention and behavior, which is the old stereotype of ADHD, but then it's also task management, which is organizing, planning, and time. I call it information management, like working memory, which is holding on to thoughts and organizing them before you use them or while you're learning from them. There is also emotional management, which is vital and the center for many kids with ADHD is recognizing that emotional reactivity is actually another executive function issue, not another thing going on. And then effort management, which is really nuanced because I think people who can't sustain effort are often just get labeled lazy or unmotivated. You need to be able to sustain effort over time. And if you want to run a marathon, you need a certain level of fitness. And that level of sustained effort is harder with ADHD also. That's the six-part model that I find I encourage people. Like if there's something challenging going around someone who you think has ADHD, I have a, I mean, take out a piece of paper. I have a worksheet too of just see, do the exercise of could this just be ADHD? Life's more complicated than that, but as a starting point to give someone the benefit of the doubt, it's forgetfulness is an ADHD symptom. And if you're just forgetting to hand in your homework over and over again, no amount of marking your grades down is going to change anything unless we actually offer you a solution. This is executive function. The second thing I think that's really important for teachers to understand is that these are just skills. And if you're behind in them, it's not about motivation and self advocacy. In fact, self advocacy is affected by having poor executive function. So it's like a long term goal to become your own self advocate. And in the short run, the most important thing is that instead of just letting someone get by, we just get in there and do the things that help them thrive in the short run, which are often adult created supports, coupled with some long term plan to help them catch up. Drop the pretense that if they just worked harder or cared more, they could overcome these executive function based issues.
What do you find are the major differences between girls and boys in your practice?
Just that, just like all the research says, the boys tend to have the more external symptoms and therefore tend to get picked up younger.
Right.
And even during the pandemic, I think that's still true. Since there aren't any overt behavioral symptoms, and actually, since executive function itself is a developmental path, that means you're not supposed to have a lot of the more complicated skills when you're young. So if you don't have early childhood executive function, mostly centers around focus, hyperactivity, impulsiveness, and that's an emotion. That's kind of it. The rest of executive function, which is where the inattentive type often runs into a hurdle, is like organization, planning, time management, this sort of more open ended managing your schoolwork type stuff. Since that isn't even expected of you in early childhood, that means that if those are your primary symptoms, they're not going to get picked up till later. So the inattentive type tends to get picked up later for very practical reasons that way. Actually, when you look at interventions for ADHD, they don't really differ much between the inattentive type and the hyperactive type, really. The same options are available. Treating an ADHD, I find, is very individualized and very complicated. There are many things that can help. There's no one thing that can help, but the same supports help different kids potentially. And the kids who begin with a lot of hyperactivity and impulsiveness typically go on to have difficulties with organization, planning, and time, and all the rest anyway. The inattentive type people are even more hesitant to discuss medication than they are with the hyperactive type. But from a practical point of view, there's no need to be really. It's just, I always feel like the medications are terribly misunderstood. totally unfair to people that there's so much judgment heaped on the decision to use them or not. They've been around about a century. They're incredibly safe and effective if they're used appropriately. And I just want people to approach the decision like they would any other medical decision. Don't use them if you don't need them. Don't run away from them either. But that goes equally for the inattentive type and the hyperactive impulsive type. The one thing that often helps focus most is going to be the medication, and that's true with or without the impulsive symptoms. I wish I could say that meditation alone could do that.
Love to know if there's any special advice you could give to parents of young girls who maybe they don't know what to look for to help them
Sure.
identify them earlier.
That's great. I think the inattentive type of in girls, I would break into two parts. There's the specific part that has to do with executive function, which is really what I just described, that it's just a recognition that organization, planning, time, emotion are often the heart of diagnosis because it's a clinical diagnosis based on just observation, getting to know someone over time. There's no great test for ADHD yet. But the broader implications of that, which I think are underappreciated, are that executive function are the skills you use to manage anything in life that requires supervision, coordination, and planning, which means it's not just school. Kids with the inattentive type of ADHD, girls in particular, are often struggling with stress and anxiety. It can affect communication, it can affect their social world. So it's a much different understanding of ADHD than most people are looking for who aren't digging a little bit. It's not necessarily failing school and it's not necessarily misbehaving. It can be more internal, this internalization of self-esteem and communication and social challenges. And the shorthand I use for parents a lot is that there is a wide range of typical development across almost any skill in life. Truly, just celebrate that difference. If you're far enough behind, or if it's impactful enough that it's affecting you chronically, you may not be in the range of typical anymore. Whether it's like chronic anxiety, chronic social communication concerns, chronic forgetfulness at school, the point where it's, oh, that again, then you might have to start thinking, maybe I want to screen for something else. Sometimes it can be, certainly anxiety is a great example. Sometimes what looks like an anxiety disorder can totally be the inattentive type of ADHD.
It's so fascinating what you said about the parents noticing ADHD maybe in their girls more during the pandemic when they were home because they noticed their schoolwork, the way that they were approaching or not approaching school. I'm just wondering if there are any better strategies now that the kids are back in school. Should parents try to be attuned to whether their child is anxious, overcompensating?
There's a concept of mindfulness that can be applied as an intention, whether or not you want to actually do the whole practice, which is objective awareness, non-judgmental awareness is really hard when you're a parent. You want to see the best in your kid and you don't want them to have a challenge because who would? It's really enmeshed and difficult. As much as you're able to take that sense of it hurts, but this issue is important. I don't know what's going on here, but I'm talked constantly is late with everything. Or the social piece, which is a gut punch for a parent. If your child's struggling socially, so many of the interventions aren't medical. Awareness is always helpful. A better understanding of what's going on is where the solutions are going to come from. Trying to just say, okay, I'm going to talk to somebody. I just need to understand this better is really important. It just does come from that broader awareness of this can look very different. Sometimes this splits in families. I saw someone this week who I saw their son first. He's highly genetic. The genetics of it are almost as strong as the genetics of height. Their son had the type of issue where he was misbehaving in the classroom, so got diagnosed young. They didn't talk to me about their daughter much for a stretch of time, and finally they did, and it became blatantly obvious that she had the inattentive type of ADHD. She had every symptom on the list. They told me afterwards, this can't be ADHD. She looks so different than her brother. How could it possibly be ADHD? But it was. And sometimes figuring out if someone has it or not could be really challenging. In my experience, take time because there's so many different views of what's going on. For her, everybody had seen it for years. But because she didn't have all the hyperactivity and impulsiveness as her brother, it was missed. That's
How
not
often,
unusual.
yeah, how often do you find that you need to talk to a physician who doesn't agree that there's a problem?
I don't find myself in conflict with pediatricians like ever that I remember particularly. But I do think there, again, in something that to me is initially just about awareness, there can be a little bit of a tendency to watch and wait, even before doing some screening scales and such, which is great. You want to be reassuring to parents, but there's not a lot of harm doing a screening test, just looking a little bit. And then I think, again, this is primarily today, I know talking about the kids with predominantly inattentive symptoms. It can be hard to tease out whether there's actually something going on in someone who on the surface just seems generally happy and well behaved. Even though if you just dig a little bit, you can find this other pattern going on.
I want to ask you about our mission. Like, how important do you think it is to diagnose girls early? And what
Oh,
age do you think is
I'm so happy you guys have taken on this mission. I think there's a big public misperception about ADHD that I think relates directly to what you're doing because it's way messier than people think. So there's always this fear that ADHD is being overdiagnosed, and it can be in some places for kids who are misbehaving. But I think what people sometimes just shrug off a little bit is that you can balance that with an equal issue with underdiagnosis of girls with the inattentive type of ADHD. And early intervention helps them thrive in general, do as well as they can academically. The fact that it is life changing for someone's self esteem and self efficacy and awareness of their own strengths and all the really vital stuff that helps someone develop to get on top of ADHD as young as possible. Anything we can do to help it get detected really early can really change lives for sure. There's a lot of sense in the field that the earlier we can intervene for ADHD really can head off difficult problems, both in terms of the practicalities in life, but really equally important on a social emotional development level.
for sure? Maybe one of the reasons that girls get underdiagnosed is just the name of ADHD, the hyperactivity. Do you think that
Oh, that's one of my running jokes when I give talks. I think they just change the name periodically to confuse as many people. Everyone in my practice still comes in and says these things. For
ADD?
all these years, people still come
Right.
in and say, I think it's ADD. The one thread that makes it vaguely useful to have it all grouped together right now is simply that people are way more complicated than the label. Anyway, most people have a mishmash of symptoms and it changes over time and changes in different settings. But to me, it would certainly make more sense to call it ADD, with or without hyperactivity. It would make the terminology so much simpler. This has become the buzzword. Yeah, totally confuses people.
How helpful is it, considering that it's the hardest thing in the world for many people with ADHD to sit still?
Mindfulness, I think, is foundationally really deeply useful with ADHD. And it starts from reframing what we're talking when we're talking about mindfulness because it doesn't involve sitting still. It doesn't involve like suppressing your thoughts or a totally quiet mind. The practice of mindfulness is more about actively building traits that help us manage life more easily. It's particularly important with ADHD because with ADHD, it's very easy to get into a cycle of stress or big emotions that just undermine your ability to do all the practical things you also have to be doing, like sticking to a new homework plan or sticking to a behavioral plan if you're a parent or making tough decisions. All just gets totally undermined when the stress and emotions around ADHD just take over. So mindfulness isn't a practice of anything. Mindfulness is something anyone can do because in the end you're trying to be more aware more often. You're trying to work with your thoughts in a way that helps you just be more skillful in navigating what are thoughts and stories and fears and what are things you actually have to be acting on. You're developing traits like patience and responsiveness, and a huge one with ADHD is self-compassion, which you can really just begin to directly work with the fact that ADHD undermines how we feel about ourselves. If you can develop self compassion, that will help you just do all the rest of the stuff you have to do and feel better. But a practice of mindfulness doesn't replace any other part of ADHD. If you can reframe it, like framing it as a practice of patience. How often do you give yourself 10, 15 minutes to just sit there? Not that you're not going to be proactive some other part of the day. It's like a training exercise. But for 10 or 15 minutes, I'm hungry. I'm not going to do my hungry thing. I'm anxious. I'm not going to do my anxious thing. I'm angry. I'm not going to do my angry thing. I'm going to develop the capacity to be aware of it without ignoring it, but without getting all caught up and reactive in it. What a powerful thing to bring into a family or as an individual to bring into ADHD care. That's really something anybody can do. If you have a busy mind when you're meditating, perfect. Then that would be a wonderful thing to work with and learn how to relate to. So all of that relates to the practice of mindfulness. And if you can build those traits of patience and responsiveness and compassion, it's fundamentally life-changing. And it doesn't matter if you have a busy mind and you're restless.
I've heard of it as lengthening the time between impulse and action, which is
Mhm.
particularly great for impulsive people.
It can help a lot with impulsivity. It can help a ton with emotion. Emotional regulation is fundamentally part of ADHD, and it is totally
About
uh,
that.
there's not much else. Therapy helps with that, although I think sometimes therapy can be descriptive of what you should be doing instead of showing you what to do.
Mhm.
It supports therapy because it is training in emotional regulation and awareness directly. And that's really powerful for anybody, but particularly with ADHD.
That's so great. Mark, you've written 4 books. What
I
is the
have.
book that you most want people to know about?
Can I say two? I have 3 books that have to do with integrating mindfulness into ADHD care in different ways. One supports parents, so that would be Mindful Parenting for ADHD is for parents supporting their kids. I have a book for teens called Mindfulness and Self-Compassion for Teenage, which I co-wrote with one of Kristen Neff's researchers. I don't think there's enough written about executive function as a developmental path, because it really can inform what we should expect of kids at different ages. Sometimes they're pushing kids too hard, too fast. Some of the reason that's true is because of executive function. The book, How Children Thrive, that I wrote is trying to make that practical information for people. Like, what should executive function look like at different ages, which happens to also be how we can sort out whether someone has ADHD or not.
That sounds great.
Mark, it was the first time I've heard about Dr. Brown's 6-part
Huh?
executive function, and I wrote down 4, so I missed 2. I
Ah,
have info, task, emotion, and effort. What are the missing 2?
oh, you missed attention and behavior.
If we worked more on telling teachers these are skills and teachers are into teaching skills, and if we prepared materials to teach the skills, evaluate which of the skills the child is missing. Don't assume they're all missing.
100%. Yeah. There's 2 things I would say about classrooms that can be really practical. One is that since executive function is a developmental skill set that all kids need to learn, these types of supports are just useful for all students. Just assume it's a skill and make sure everybody knows whatever skill it is you expect them to manage your class. Executive function is practical. It lays out things in a way that's understandable, and everyone's different. There's no rule to what strengths and what struggles somebody's going to have, but it just gives you a model to explore.
I might have misunderstood Ari Tuckman, but he's talked like the executive function skills are not teachable for people with ADD, but the setup to perform the function is what you're teaching them. So you make it more possible for them to be aware of time, but you can't get them to overcome their time blindness.
It's nuance. There's a subtlety to this, which is what do you call a support and what do you call a learned executive function? For some aspects of executive function, you can internalize the routines you're learning and you're relying on that internalized habit. But on a practical level, I'm not sure once you've made it your own, whether that means you've developed that executive function skill or whether you are compensating for it.
Yeah,
Once you,
if you're
you know,
using adaptive methods, but you're achieving the
yeah.
end result.
Correct. So I agree with Ari, though, that most of managing executive function is more about externalizing the system. It's developing a routine for yourself that's just going to help you do great in life. If you just develop the routine that helps, I'm forgetful, so I'm going to do this, and time's hard, so I'm going to do that. It totally ties to self-compassion, too. I'm not going to blame myself for it. I'm a wonderful person. It's just part of my ADHD. Most of the time, you're building in supports, but other places you might have learned something so specifically that you don't need the external support anymore. But overall, it's usually developing that external system.
I think the only thing to say is thank you so much for your time and your wisdom today. It's really great talking with you.
Oh, thank you so much. It was a pleasure talking to you both. Appreciate it.
We believe all girls with ADHD should get a fair start in life by getting diagnosed by age 8. Visit us at www.FINDtheADHDgirls.org. Thank you.